You had a point. Please proceed.
Yeah, but now I digress a little bit. I think my wife called me yesterday. I asked her,
what should I wear to the interview?
And you had the memo, apparently.
I didn't have the memo. I asked my wife, what should I wear? And she said, wear your reddish coat. Okay. I had a host of ties. She rejected all of them. I know she's laughing where she is.
Yeah.
Hotness, I'll get you. Anyway, but what was alluding to was the matter of hostels. Because in this generation, that idea of hostels determining what the patient wants and going, no matter what the patient wants, that has to change. Now, in 2024, doctors and patients must work like this. Doctors are not kings. We work together, discuss, and progress. Issues of ratios of nursing to patients, 1 to 10 may happen in centers that are restrained, but the nursing council has a requirement of 1 to 1 for ICU, 1 to 2 for HDU, and 1 to 6 in the ward. And this has to be, adhered to. Not doing that is not acceptable. It brings another point around home-based care. In hospitals, to some degree, there is some quality control, and it's important for us to have, a framework to look at how we are going to handle quality control in the home-based care system. How do you regulate this space? Data is a big part. Right now, we are talking about telehealth is a big part of what is being done. How do we ensure that all these things are perfectly aligned to the patient's best interest?
Yes, Duncan, final word.
Final word?
Yes.
Now, I would like to tell the community, on those people who are watching us, we are on Facebook, we are on Twitter, Duncan Home-Based Care. If you want to ask any questions, you want to us to provide care for you, we are available. We are on Facebook, we are on Twitter at Duncan Home-Based Care. If you contact us, you need a caregiver, you need a nurse, we have them trained who can take good care of your patient at your homes. At very cost effective. We would like to also, I would like to concern about NHIF. What we do, it's above us, so that the NHIF can cover several patients at home, and then the insurances. It's an issue, Daktari, where insurances, I don't think they are covering some of the home-based care and the NHIF. It's an issue that are concerned, so that those who are able, they are paying the NHIF, but at home they can't cover, you see. I think we should come up with a scenario where the NHIF should cover home-based care. It's a care like the hospital, you see? Yeah, it's a care like any other, so it's a concern.
For clarity, Duncan and I are meeting for the first time today. We're not in the same sector, but we do agree on a lot of things around home-based care. Number two, Duncan, to allay your fear about this, the adoption is slow. This is how the natural evolution. But I think with time, as home-based care manifests itself, people will see the advantages and they'll begin to cover as much as possible. I think for us to be vigilant, because there are all these good sides, but everything that has a good side has its difficult side. So we be vigilant as the population as well.
Thank you. Dr. Victor Ng'ani, critical care doctor, your time is appreciated. Thank you for your time and the input you have given us here on the broadcast, and as well to that of Duncan Gekude Mbaye, who is a critical care nurse here on the segment Health and Lifestyle, for joining us and giving us your account of what needs to be done, who to engage, what to do, when to do, and the level of course, preparedness in case of any emergency, and the swift response needed from these critical caregivers. And thanks to you too for waking up with us here on the broadcast from 6 a.m. to now. We thank you for your feedback and as well keeping us company. It's appreciated and of course privileged. Thank you so much. We'll see you on Friday morning here on the broadcast at the same time. Till then, good morning.